Good afternoon. My name is Brian Hanft. I'm the Director of Public Health. I want to take a quick minute while I have the viewers and listeners' attention and just say thank you to the community. It's been quite a last couple of months, and we know what we have before us. And I know together, working in unison and knowing that we have the support of our community, our elected officials, and we know that we can move through this and get past this. I think it's important that we reflect on kind of where we've come. In the last 2 months, the Department of Public Health, in partnership with so many agencies around the community, have been really preparing for this. And going back further than that, the Department of Public Health, since around 9/11, has been planning for an event of this nature. We have plans. We have exercised these plans, and we have worked very hard to make sure that we have the mechanisms in place to be able to provide an adequate response, if there is such a thing in a case like this. So I just want to talk a little bit. The Department of Public Health, approximately 2 months ago, initiated our incident action plan. And with that, we established who our incident command would be. And so we've been working on this every couple of days. We sit down and establish what that plan looks like. Several weeks ago, mid-February, we established the emergency operations team and started to meet as a group with local law enforcement, with hospital, with the emergency operations center staff, and other agencies to start to determine, are we prepared for what's to come and things that we need to initiate. During that process, we strategized going forward how we're going to begin pulling a lot of our partners together. As part of that, over the last week, and I want to reflect on the governor's initial press conference that Iowa had their first case, Sunday before last. So in a matter of 9 days, escalation has happened tremendously. In that time, we have initiated a call center for people to call into. We've initiated our Joint Information Center so that we can provide regular and routine concerted together communication with our partners. We have worked with our school administration talking about school closures, which then eventually led to the governor's directive and recommendation for schools to close. On Sunday, we met with our child care facilities after the school closures were announced, in recognition that we needed to work very hard to still provide child care for primarily our first responders. It's essential that we have first responders that can go to work, but then also recognizing that there's also essential services within our community, as Mayor Schickel referenced, that we still need to provide child care for. So as we worked with child care to establish control measures within those facilities to make sure that we're taking the precautions that we need to, we feel like we have a very good plan moving forward, trying to provide the best case scenario for those kids and those families so that they can continue to respond. I want to reflect on the fact that we continue to try to push out current and relevant information to the public through our Facebook page, through Twitter accounts. We're trying to communicate with the community at least twice a day, and then reposting our partner information as often as we can. You know, we work with our media partners, and I can't say thank you enough to the work that they have done to help us get the messages out in a timely fashion. I know I haven't been as accessible as I would like to be, but under the circumstances, some of my colleagues are really helpful in trying to maintain that. So I just want to touch a little bit on the coming weeks, and I should say a day feels like a week anymore. But we know that we're going to see localized cases for sure. We know that we have community spread throughout the state of Iowa, and that will continue to occur. We will be moving into likely contact tracing, which is going to really draw in the Department of Public Health and impact our capacity to otherwise provide routine services. I should remind everyone, with the proclamation today, our department has now rolled into activation level red, which is as urgent as it gets. So we have basically closed our doors so that we can utilize our staff for appropriate response and helping out our partners and such. So contact tracing is going to be following up with those people who may have come into contact with a positive case. And so trying to contain this is part of what public health efforts will be, so we'll be working on that. Social distancing, as the mayor said, is going to be essential. We are really, really pleading with the public that if you can stay home, please do so. I still see a lot of cars out, and maybe that's necessary, driving around and moving about within our community, but I'm really asking for people to stay home if you possibly can. It is essential that people stay home when they're sick, and this is probably one of the biggest messages that our partners, our hospital partners, the clinics, and the public health department want to stress, is that there are people who are going to become ill who might have mild symptoms. And there might be people who are ill that don't have COVID-19, that might maybe have mild symptoms, they don't feel well. But we really need to try to reduce the overall surge on our hospital. That is key right now. And so working with the hospital, one of the key things that we're focusing on is how we can otherwise ramp up our testing of our community. And I'm really speaking to, really the entire network that Mercy represents. That is approximately 14 counties. And so we know that the testing is needed, but let me just explain something to you. The reason why testing has not really rolled into full force is because of a national shortage on testing supplies. And so we're working as hard as we can. I spent time today on the phone with the State Hygienic Laboratory, seeing if we can get additional samples to be able to collect additional tests. And we are working our hardest right now to be able to fulfill as much testing as we possibly can. Right now we're focused on working with the emergency department to make sure that they have the tests that they need in order to deal with people that are coming in their doors. So with that, staying home if you're sick really does help the hospital, as what we call it is flatten the curve. We're trying to save the community from having a spike in the number of people who are seeking care. And so this is a strategy. It is a strategy that our community and our partners, we continue to work on. We're doing the best we can and trying to write this playbook as it unfolds. And so with that, I want to once again thank you to our partners, Dr. Mock, to the hospital, to the cities, to the schools, to the child care centers, to the businesses, to the grocery stores. I mean, everybody's doing a fantastic job, and I'm proud to stand here before you as the Director of Public Health and try to bring everything we've got to this situation. So with that, I'll turn it over to Dr. Mock, and she can give some words and then hopefully take some quick questions.